Welcome everybody to this Health Data Collaborative webinar. We're the hosting platform, but it's really going to be run by the working group on health data governance. Welcome everyone. This is a hugely important issue, not only for the Health Data Collaborative, but most importantly, getting data right, the quality and integrity of data right for health outcomes. So on the agenda today, hoping that video can put it on if possible.
I can. Apologies, just give me 1 second.
Just a bit of housekeeping as we go through the agenda. If you have comments or if you have questions, please put them in the chat and we'll try and respond to them as best we can. After my brief introduction, we're going to hear from Letitia Whalers from South Africa. We're going to hear also from Pam Dixon, and Parminder Jeet Singh. And then from a regional perspective, we've got Jocelyn from Rekinsa, Jai from Ahin, and Dr. Francis from Helena as well. And then we're going to have Q&A for about 10 minutes. There's going to be a series of presentations and inputs from a range of participants, and then we'll have Q&A. So with those Q&A, please put them in the chat so we can deal with them and prepare accordingly. So next slide. I think it's my role to really introduce the Health Data Collaborative and make sure everyone's aware of what it is and how it works and how it functions. And I want to, first of all, thank everybody on the call really for really being part of the Health Data Collaborative. It's your collaborative. You make it work. You make it work through the 7 constituencies we've got. We rely on a diverse range of perspectives, from countries to donors to multilaterals to civil society to private sector to academia to global health initiative and others as well. So it's really your collaborative. It was started in 2016. It has 3 main objectives. One is to support countries strengthening their health information systems. Second is to align partner resources, whether they be finances, technical or political, around government and country priorities. And the last objective is really to help contextualize global tools for local context as well. And the Health Data Collaborative has grown over the last 3 years. There are 42 partner organizations. I think we're up to over 700 members now, aligned around that in the different constituencies. And there are several different technical working group, which we call the technical engines of the Health Data Collaborative. So next slide. And these technical engines are really focused on 7 technical areas that we all know are important to basically use and collect and store and share data for better data. One is civil registrations and vital statistics, which is led by WHO and London School of Tropical Medicine. And when I say led, I'm meaning co-chair. So co-chair is a huge effort, and the co-chairs of each of these working groups give up, and also the members give up a lot of their time to make the working groups function. There's the Community Data Working Group led by UNICEF and USAID. The Data and Digital Governance Working Group, which is this one, is led by the University of New York, Palladium and USAID. There's Digital Health and Interoperability, the biggest working group, which is huge, has co-chairs from USAID, WHO, Open Communities and PATH as well. LMIS led by USAID and WHO. Public Health Intelligence is our newest working group, led by CDC and Carl from WHO, and then Routine Health Information Systems led by WHO and our colleague from Rhino as well. So I'm mentioning all these because the Health Data Collaborative provides focus on technical areas, and this specific topic of the webinar today, data governance, is hugely important. So we're going to hear from different colleagues on why it's important, really for health, and what governance really is. It's a kind of quite often a confusing topic, and I'd like to just explain a little bit before handing over. Next slide. So some of the data governance efforts have been renewed focus on that, mainly because, not because of, but as a side byproduct of the pandemic in the last couple of years. Been a lot more renewed focus on data, its quality, its integrity, how to manage data, how to use data, how to visualize data. A lot more focus over the last 3 years. which has gone into a lot of detail on governance and how to govern data. There's a greater need for intersectoral connection. So data governance needs to connect from health to all the multisectoral determinants of health that we all know so well. And then lastly, it's basically a need to apply some of the principles and policies. You'll hear from colleagues that data governance relies heavily on principles and policies, but it's much more, what do these mean for the end user? The nurse midwife in a far off rural remote village, for example, or a minister of health, for example, trying to tailor and struggle with resource allocation. I just want to draw your attention to some of the more UN-centric bits of work that's gone on. Obviously in WHO, we have our data principles, which were approved a couple of years ago. And there was a data governance summit last year, and which made the case for data as a global public good. And a lot of good practices were identified from multiple partners during that summit last year. And then there's two other bits of work I wanted to draw your attention to. One is actually the UN Secretary General data strategy, of which principles is a component of that. And in these slides, you'll have the links, but I encourage anyone to kind of look at that. It's been a lot of thought and effort into them. And then there's the UN Statistics Division, which had come up with a stream of work on data stewardship and governance as well. And I mention that because that actually broadens our perspective beyond health into many other sectors and focuses on data as a strategic asset. But also principles for digital development. Many of you on the call on this webinar have been working on them. And then there's the principles for donor alignment in digital health, a huge bit of work going on in digital health as well. And then next slide. So I think that's it from me. I forgot to introduce myself. I apologize. My name's Craig Burgess, and I work in WHO in the new division for data analytics and delivery for impact. But I also want to acknowledge my colleague Mwenya, who helps facilitate much of the Health Data Collaborative, and Alex as well, who manages many of the working groups as well. I wanted to leave just this slide just as food for thought, because it's our own in WHO. We thought about it long and hard what data governance is. We're kind of creating this paradigm or framework that data is everybody's responsibility and shouldn't necessarily be in silos. And if we can look at it in terms of from collection through to use, there's a series of often non-linear steps, including cleaning and validation, sharing and analysis, storage and visualization, that if we could break it down into kind of chunks like that, we're finding quite a good way of looking at data governance and really getting practical, because everybody can see their data in these steps as well. So I wanted to thank everyone for joining. I'm going to hand over now after that introduction. Apologies. I think I'm handing over to
Hi, Craig.
in front of me. Apologies. I'm handing over to Pam, I think.
We're actually heading to Letitia next.
Letitia, I beg your pardon. Letitia, over to you. Thank you, Letitia.
Craig, thanks for that welcome and intro. And kind of one thing that I want to highlight that you mentioned really is kind of the way our data moves through a journey. And in a lot of the data that we work with, we may need to think about it differently, whether it's digital or whether it isn't. And for those of you who have noted the name of this working group, we focus on governance across data and digital. And that's one thing that I'd like you to keep in mind as we continue through this session. Letitia, over to you.
Thank you, Vidya. Thank you, everyone. So I'm going to say hi and switch off my video just for bandwidth purposes, but very welcome and super happy to be here. So why is health governance important? The World Health Organization came up with the Health Information Systems Continuum, and essentially as a framework for discussing the major components of health information systems, or HIS as we know it, in the context of country ownership. So it was very important, and they identified 7 major leadership and coordination components, ranging from governance and multi-sectoral engagement, strategic planning and financing, architecture, right down to system and data interoperability. And what this tells us, the importance of context, the importance that every country understands, interprets, and how they value and use their data. Furthermore, the OECD states in 2015 that it's in order to maximize societal benefits and minimize societal risks as new data sources and new technologies are introduced. So what we can see here, furthermore, from last year's summit, the outcome statement also recognized the need and calls for a common framework and good data governance practices, underpinned by a globally unifying set of principles. The Lancet and Financial Times Commission Governing Health Futures 2030 calls for a new approach to the collection and use of health data, how we protect individual rights and promote public good potential of such data. Just to bring it a little bit closer to my part of the world here in South Africa, when we had to develop a response to the COVID pandemic, we were called on to develop contact tracing database, and we were on the verge of our Protection of Personal Information Act coming into place. Our information regulator then brought out specific guidelines to protect the nation's data, and those guidelines had to be adhered to. We've also had another example where we are in the process. We have our National Health Insurance Bill 2019, and similarly, or it is towards universal health coverage. And here again, there's the need to establish information platform and national health information system. So thus underscoring the need to comply with general privacy and data protection laws and regulations. Next slide, Vidya, please. So then, now that we know why health governance is important, let's look a little bit about health data governance importance. And here we can see that with the increased digitalization of health systems, we are faced with a vast increase in the amount of health data. The pandemic have just sort of put the spotlight on how it's collected and also how it's used. Furthermore, the need for better and more equitable governance of such data. The health data governance is also important because it supports equitable and responsible health data management while safeguarding data privacy, ownership, and security. So it's overall this need for a global alignment on a core set of principles and framework to promote a common understanding of what data governance should accomplish. Can we have the next slide, please? So the Lancet and Financial Times Commission made some recommendations and also some calls for action. And here we find under the recommendations that they've made is that digital health stakeholders need to consider and address digital technologies have an increasingly importance as determinants of health. There's also that there's this need to build governance architectures that creates trust. In terms of the calls for actions were around data solidarity with the aim of simultaneously protecting individual rights, around digital trust for promoting public good potential, furthermore around accountability to enhance data justice and equity. Then also they called for requirement for public participation to enhance strong country ownership of digital health strategies and investment roadmaps. And that's in a nutshell around the importance for data governance, data health, and health data governance. Thank you so much. I'm ready to hand over back to you, Vidya.
Thank you, Letitia. And thank you for highlighting some of a lot of the newer policies that are coming into place, and to kind of take a step back. So we've been talking about health data governance here, but to answer one of the bigger questions that has come up around why we need sector-specific data governance, I'm going to hand things over to Pam.
Thank you so much. Good morning and good evening to all. It's a real pleasure to be here. Thank you for your invitation. I am pleased to be part of the Data Governance Working Group. where we're working on these issues intensively. I am going to give a talk that may be a little bit coming from a different angle than what you might expect on a health data governance webinar. But I promise you, at the end, it will all make sense if you can bear with me. Next slide, please. Okay, so for the past 25 years, I've worked very intensively as a researcher in data governance ecosystems and in complex data ecosystems, particularly digital ecosystems and all sorts of different ecosystems where analog and digital data is combined. And just if it's a complicated ecosystem and there's governance involved, I've probably researched it. I wanted to draw your attention and compare three very, very critically important ecosystems so you get a feel for why health data governance is different and how the ecosystem itself requires a couple of different approaches to governance. So I'm going to start with very large, very complex data ecosystems. And the first one I'd like to talk about is the Aadhaar data ecosystem. The Aadhaar data ecosystem is actually an ecosystem that lives in India, and it is an identity ecosystem. It happens to be one of the largest data ecosystems in the entire world. It is comprised of more than 1.3 billion enrollees, and there is a biometric enrollment, and there is all sorts of qualified and verified demographic data and birth registration data that goes along with this. In addition to this, the Aadhaar ecosystem, it functions in real time. And the way that this has been utilized in India is often called the India stack, where many services are added onto the identity ecosystem. So for Aadhaar, there are really a lot of functions, but there are three primary functions where the identity ecosystem serves to authenticate individuals, to identify individuals, and also to provide services to the right individual in a very timely fashion. So the way that this has been built out is quite extensive. Now, an ecosystem like this has to have governance, and there is an entire piece of legislation in India that is focused entirely on the governance of this ecosystem. In addition to that, there is something called the Identity Authority in India, an entire part of government that is dedicated to managing this particular ecosystem, to ensuring compliance, and so on and so forth. The system is not perfect, but it's very functional, and each year it improves in terms of how it's being administered. So for example, recently there was tokenization added to increase privacy. So this ecosystem is less complex than very large health ecosystems, and yet it's one of the largest ecosystems in the entire world. And let me move to the next ecosystem, which is FINRA. For those of you who are not familiar with the FINRA ecosystem, it's a very, very important ecosystem. So for all of securities trading, to ensure that there's not security fraud all over the world, FINRA uses artificial intelligence and real-time systems to monitor all of the actions each day. So in this system, in real time, you see more than 100 billion transactions happen each day across this system. And this system is regulated. It's highly regulated, actually. And it's regulated in the United States by the financial sector, various parts of the financial sector, but in particular, regulations having to do with the Securities and Exchange Commission. The reason I mention this system is because it is quite notable for its ability to do compliance. Also, the system has a unitary purpose. It's looking at these transactions to see, to catch, bad actors. So again, both in the Aadhaar system and in the FINRA ecosystem, both of which are absolutely huge, they have very narrow, very specific goals in mind that can be adjudicated fairly easily. Now let's move to the health data ecosystem. So I'm just going to use the health data ecosystem writ large because there are so many different ways that health data ecosystems are utilized. So for example, in most health data ecosystems, there is going to be a national health authority at the subnational or national level somewhere. There may even be a regional health authority. There is going to be some kind of implementing statute. In Europe, there is a statute. In India, there's a statute. In the various countries of the world, there are usually a statute having to do with health data. And there are a lot of differences between these statutes worldwide, but there's almost always a statute that covers this because people really care about the confidentiality and privacy and security of their health data with good reason. At this time, what is happening with the health data ecosystem is that it's moving, as we all know, from paper to digital, but there are pieces of the health data ecosystem that are already moving to real-time AI or artificial intelligence-based systems. And this creates profound changes. When you look at the spectrum of the ecosystem, it's really challenging. So the Aadhaar ecosystem is all real time. The FINRA ecosystem is all real time. But the health data ecosystem needs rules that cover everything from analog to digital to very advanced AI in real time. The principles have to cover all of it. And for this reason, data governance becomes very important at the principles level to get right. And then the other thing about health data ecosystems that's quite different from many ecosystems is that there are more tasks involved for the data. So for example, those who live in the United States will recognize the first three words I put on this: treatment, payment, and operations. This is really the cornerstone of the federal privacy regulation in the United States, HIPAA. But also there's research, there's public health purposes, and we can add many, many more. But the health data ecosystem has to do a lot of things. And as a result, health data ecosystems need their own principles, and they need very specific governance adapted and tuned to each ecosystem, which makes health data ecosystems among the most complex and most difficult to regulate because there will be meaningful differences. It is not possible. Well, let's see what is possible. What is possible is to have principles that apply broadly to all health data ecosystems. What is not possible is to have a single framework apply to all health data ecosystems. It's simply not possible because of the extraordinary variety of the ecosystems. So what do? Well, typically what's done in an ecosystem is you take the principles and then you move them into their specific regional, cultural contexts and make sure that that regional and economic and cultural and political context supports a type of specific framework to implement the principles. It really needs to be decided at the local contextual level. And then as the health data applications for the principles get smaller and smaller. So for example, if you're talking about a health clinic in the Democratic Republic of the Congo, DRC, that is going to need very different rules, a very different framework than, for example, a clinic perhaps in Europe, which is dealing with public health instead of maternal health, and so on and so forth. So there are many, many different configurations that can be had. So governance, health data governance principles are of just incredible importance to really get the first button on the vest in the right spot. And then the frameworks which are developed from those principles, if they're developed with good context and real integrity for the uses of the data, then you can arrive at a very aligned set of principles to framework, and then of course to compliance and management and continual improvement of that system. So what I really wanted to do is give you a look at how health data lives in an ecosystem. And the one thing I would leave you with is this: the pathway that other ecosystems have taken is they've moved from analog to digital to real time, enabled with AI. It's a really significant pattern in ecosystems, especially large and complex ecosystems. So I fully expect that health data ecosystems will also move this direction. And we've got to make sure we've got really great principles in place that are adaptable to and flexible, so that as the health system advances into a mature stage, that the principles still are applicable and the framework can then be updated. All right, so I am looking forward to this conversation, and I am very happy to answer any questions that come up. I'll be monitoring the chat. So thank you again.
Thanks, Pam. And now that we've kind of gone through the rationale for needing health data governance principles and why we need sector-specific principles, we're going to actually dig into the health data governance principles. So I'm going to hand over to Parminder to introduce himself and give a very brief overview of the health data governance principles that were released last month.
Thank you, Vidya, and thank you for inviting me here. I'm Parminder Jeet Singh from an NGO IT for Change, but here I come as a part of the Data Policy Circle of Transform Health, which is an initiative which developed, developed these health data principles, which we would talk about now. I thank Pam for complexifying this area of health data principles, and also earlier Latricia and Craig for talking about the background of health data principles. Now, the question when we went for the consultations of these principles was that, why do you need another set of principles? Aren't there already many sets of data governance principles or data principles in general? So why do you need this? So, well, let me try to answer that question. Most health data principles, and I'm not saying all, generally tend to have been more on the technical side. It's like, you know, we are doing certain set of activities and we get computers, and then we use computers to do the same set of activities in a better manner. In the same way, we do certain kind of things, we get data, increasingly the data is richer, more complex, and we use that data to do those same activities in a better manner. But as we understand digitalization, we recognize that digitalization is transformative. And when digitalization actually gets imbued in a system in a really, you know, mature manner, the system changes. And therefore, we need to talk about not just what data we are using, use it in a better manner, but what are the objectives of the system and what would a datafied or digital system actually do? So we need to go back and claim objectives of datafication of the system. And that's why we were very sure that now we are past that stage where data governance is just about those technical matters, you know, the hygiene stuff, how you keep them safe, keep data safe, how data is available, how data is stored, and so on. Apart from the fact that the privacy element, do no harm to individuals, was generally included, but still largely it was in that technical sense of, you know, what I could call as hygiene. And again, I am not trying to do a 0-1 statement here, not that everything about them was technical and non-social political, but in these principles, we were very clear that we are now going to go beyond the technical and claim the social political objectives of what we are trying to do. In that sense, Pam was right. The different kind of health systems may have different objectives. So we were very clear, and that's the byline of our health data principles, which is universalizing the benefits of health digitalization. So we were now going to have a set of health data principles who had an objective. Their objective was merely not the objective of the system which they were serving, but they themselves had an objective. And the objective was to universalize the benefits of health digitalization. And then we broke up into further socio-political objectives. And I moved the slides a little later, but I wanted to give a background of why these principles and what is the overall framework of these principles. And then we sought to understand what is it we are trying to do. And then we split the objectives in 3 parts. So these are the sub headings under which the principles are organized. The first thing was protect people. And that's, of course, do no harm is a big principle in health practice. Second was, why do you use data in health? that is obviously to increase the health value which can be provided. So we need to have principles such that it promotes health value. We have to have health data governance in a manner specifically that how does it create more health value. And third was prioritize equity. It's not enough that we overall increase the size of the pie, but we also want to distribute the pie more equitably. And as I said, the subline of the principle was to universalizing the benefits of digitalization. So we were very clear that equity principle would clearly be prioritized. And we have looked at each element of what data does, what data can do potentially from these three lenses. And two other cross-cutting lenses were that most of the time data principles were only oriented to preventing individual harm. We thought that it's not just the individual who may be benefited or harmed, but the whole community, whole society would be possibly harmed or benefited. So all the principles were seen from the individual lens. We talk about protecting community, but individuals, but also groups and communities. When we talk about promoting health value, we can have a horizontal view of our past health data, but we also need insights which improve the health outcomes for the whole community. And prioritizing equity, it's not just a matter of individuals get equitable health services, but communities, geographic regions, geopolitically, we have an equitable spread of health benefits. So, and as I've already been talking, that universal health coverage was a key principle and human rights were the other cross-cutting principles. The idea was that health data governance is not just to see whatever system this data system serves has a better output as per its own objectives, but we are now looking at health data governance from the socio-political objective side as well. Apart from the fact that we were also looking at the technical parts. Now I'm going quickly to run you through the actual principles in the next 3-4 minutes, which I have got. You can go to the next slide. So for protect people, we had 3 sets of principles. There are sub-principles under it: protect individuals and communities, build trust in data systems, and ensure data security. So I would also lay out the principles under each. There are core elements of protect individuals and communities, and I have to rush through these, but the core elements are address individual and collective risk, collect data with a defined purpose, collect personal or sensitive data only when necessary and with informed consent, use secure data collection and storage mechanisms, use de-identification and anonymization, define inappropriate uses of health data, institute safeguards against discrimination, stigma, harassment, and bias, and provide guidance specific to marginalized groups and populations. And of course, all of these are explained. Build trust in data system is the second subheading, which has these elements of aligning with best practices, ensure consent, obtain collective consent. These are the collective elements which we were very particular about. Define concrete exceptions to informed consent, ensure data quality, availability, accessibility, reinforce health data governance with evidence, establish transparent and accessible processes and systems, and institute feedback and accountability mechanism. One part which is again would keep on coming up is the participation of individuals and communities in managing systems. And the third part of protection was ensuring data security, which already also has 4 elements, but I will go to the next one. The next subheading was promote health value. Again, it has elements of enhance health systems and services. We wanted to take a system and services wide view, encourage a culture of data-led insights and actions. There are 6 principles under it, and strengthen community ownership of health data, which is a new concept. And again, somebody had talked about how does the health worker feel. So enabling and empowering frontline health worker is another key objective. Promoting data sharing and interoperability is the second principle, with that core elements. Again, I wouldn't go through them. Facilitate innovation using health data. which goes into core elements of apply health data governance to emerging technologies, address the use of non-health data in health contexts, build public health data infrastructure, and employ policy innovation. And the last one is prioritize equity. Now, this part was important, and I think one of the more original contributions of this these health data principles. One part is promote equitable benefit from health data. It has core elements of represent all groups and population equitably in data, consider the unique needs of marginalized groups and populations, mitigate data bias, use accessible language, and plug knowledge gaps, implement inclusive data feedback mechanisms, and promote equitable impact and benefits. And the last part is to establish data rights and ownership. Core elements are apply a human rights lens to health data governance, define clear governance roles and responsibilities, codify data rights and ownership, extend data rights and ownership to products and services, which also includes AI. And the last speaker was talking about how our health data principles should be ready to an AI-based health system, developing health data trust and health data cooperatives, employing participatory data governance mechanisms, and connecting to broader accountability mechanisms. Sorry, I had to rush through these many principles. So we are open for questions, and I would hand it over back to Vidya now.
Thank you, Parminder, for going through the principles and providing a little bit more context after Pam's conversation. For anyone who does want to know more about the principles, there are a number of links in the chat, and there are several other events going on. So we can make sure to share any of those out there. And from here, one thing that we wanted to focus on today was taking the principles and taking this need for health data governance and applying it to regions. So we have representatives from Rakainza, Ahin, and Helena. So I'm going to hand it over to Jocelyn, Jay, and Dr. Francis. Thanks for being here.
Thank you very much. Good morning. I'm Jocelyn Carillas. I am the General Manager at the Central American Health Informatic Network, and I'm also part of the Data Policy Circle at Transform Health, and also I'm one of the co-chairs at the Small Working Group of Gender and DEI at the Digital Health and Interoperability Working Group. So I feel like I'm in home. So I'll start the conversation around the regional perspectives on the principles. And next slide, please. To put you all into context, many countries in Latin America are working towards the strengthening of their capacity to employ health information to inform policy, strategy, and operational and clinical decision-making. Despite the proliferation of data, many health organizations struggle to generate data that provide actionable information. Data governance should prioritize investment, establish policies, protect the data and information assets, and determine accountability for data governance. But this has not been achieved in my region. In many countries, the MOUs are the entity best positioned to take the national leadership role in establishing data governance within the health systems. However, depending on the national context, other national agencies or stakeholders are taking this role. And whether or not the MOUs adopt the national lead role for data governance, as an organization that collects and uses health information for decision-making, in some cases, they establish their own data governance practices. So next slide, please. Next slide. So why it is important to have a set of health data governance principles in Latin America. And these are some of the findings that we have gotten from all the process of the development of the principles in a region. And first, I would like to make these precisions around not only the principles, but also around the reflection that Latin America is a very complex region in terms of demography, ethnicity, poverty, literacy, violence, health and justice systems, among others. And as Parminder has mentioned, this set of principles are based on human rights and equity, that in my region, they have a slower tradition than in Europe, for example, which dates back in 1948. So first, data governance is such a sensitive issue that is either a public matter or a state of matter. The state cares about what happened to its citizens. Governments have the burden of assuring citizens how, when, why, and for what purpose their data should be used, or will be adequate, or will be rectified, anonymized, etc. In Latin America, Latin America do not escape this logic, okay? Second of all, Latin America has insufficient maturity with respect to data sovereignty and digital governance. Perhaps there are exceptions, for example, Brazil or Mexico for its productive development in extension, and these are federal governments, and Costa Rica, for example, for its banking technification. Third, in Latin America, Latin America doesn't have the same European tradition regarding the culture of contact tracing beyond the existing digital technologies that we know. Europe, for example, has had an ethics regarding the ethics in the government of the autonomy of will and distributive justice that Latin America do not know. And this is because of cultural, political, and economic issues. Another topic to mention is that cultural issues lie in the fact that the Americas, with the exception of North America, have the stigma of the colony and of an ethnicity that is not even recognized in their population banks. Another topic to mention is that those related to the economy, they refer to the lack of financing that would allow digital deployment. Technology transfers from the north, come from the North, Europe, and USA, and China. However, we can state that research in our region is of quality. It enjoys of high academic tradition from research, but with difficulties to make the bridge to innovation that mostly come from funding from private sector. So other issues related to politics and coordinated governance of transnational governments agencies, for example, have been on the rise since the late 1990s, and more precisely in the 2000s. For without any protection of local laws, such transfer of technologies and their faulty use could bring disadvantages to the to headquarters making their local investments. Data, its governance and development go in their logic hand in hand. And there is no doubt that development goals have put it on the agenda to be achieved within the next years. And to finalize, to understand that the autonomy of individuals, let's say their ability to know their rights to self-determination and to demand such recognition of their dignity property and privacy, sets a minimum floor against the abusive use of data that exceeds its proportion of being used. Data for what? What would I be? Those are those to mention. For this reason, any conflict between access to information and protection of information in terms of confidentiality, privacy, and security are 2 points of tension that do not or should not find a rigid position. Health, to understand that everything that happens with people's data in general is a governance thing, because it must be clear that for this, there are universal principles of ethics that are autonomy, informed consent as an expression of that autonomy, the justice of access of a digital good, or byproduct emerging from the use of common data that without violating such autonomy in terms of security and privacy, achieve the riches of sharing a data between human beings. That is the paradigm of data for good. And well, the transformation, digital health, transform health, I'm sorry, in the regional partners have been taking these ethical principles and transform them into this bundle of principles. And well, Parminder has explained them masterfully. So thank you very much. And over to my next colleague. Thank you.
Thank you, Jocelyn. I'm going to hand over to Dr. Francis. If I can actually get over to her slides quickly. Dr. Francis, there you are.
Yes,
thanks for joining us.
Much. Yeah, thank you so much for having us. So I'm here representing the Pan-African Health Informatics Association, but more popularly known as HELINA. And having the opportunity to, work with the Transform Health on the health data governance principles is quite opportune, because it's actually at the core of HELINA's values, which are focused on relevance, accountability, integrity, and transparency. So I think it's been an easy marriage for us, helping to focus and then get endorsements and alignment with the principles. And so HELINA has been working on this within the African region, and our aim was to try and get perspectives from all the 4 sub-regional areas, so primarily the Western Africa, Eastern, Central, and then Southern Africa. And so we have 4 countries representing HELINA in trying to put across these activities. That's Ghana, Cameroon, Kenya, and then Botswana. And so our activities have primarily been around advocacy and getting endorsements for the HDG principles. Now, our activities are around engagement with government and CSOs, trying to convene national and regional roundtables, sensitizing and sharing the HDG principles with key national digital health stakeholders, trying to lobby ministries of health, ministries of ICT on the HDG principles, and then actually getting the countries to support resolutions on the global data governance framework. And so these activities have been ongoing, and it's a process which we expect to go on for a little while, around awareness, literacy, endorsement activities. For example, in Ghana this week, there was a health summit, a national health summit, and the focus was primarily on digital health systems and how they're supporting universal health coverage. And so there was the initiative to discuss how data governance plays a huge role in ensuring that digital health systems can actually help us achieve the universal health coverage. And so there's a move to ensure that a digital health platform is created, and then so that all digital health systems and data that's being generated through these digital health systems actually abide by these principles and are developed and governed appropriately by these principles, so that we can ensure universal health coverage and all geared towards helping achieving the SDGs for the country. And this similar activities are happening across the other countries. In Cameroon, there's been a publication around this activity and endorsements also in Kenya and then Botswana. And so we're hoping that as time goes on, we're going to be able to get more endorsements, get more activities around the HDG principles and create more awareness and more interest in ensuring that there's proper governance of health data, so that the population can feel secure, they can feel their data is being well taken care of, and they can actually have some trust in the stakeholders who are handling health data, the digital health data. All right, so thank you. That's a little from Pan-African Health Informatics Association, and we'll move on to Jay.
Thanks, Francis. This is Jay here from AHIN, Asia eHealth Information Network. And I think most of you might be already aware of AHIN. And AHIN has presence in over 60 countries, but our mandate is specifically for the Southeast Asian and the Western Pacific in terms of WHO regions. And then we conduct a variety of capacity building, and then we work together with the Ministries of Health in terms of arranging the convergence workshop for the HIS strengthening and digital health. And then let me share what we been doing recently together with Transform Health for health data governance principles. In March last year, actually, we were part of the regional workshop we conducted together with Transform Health and PAT on March 19th. And then those inputs actually flowed into the global workshop. And then, of course, as Parminder and other colleagues have mentioned, it took a whole spectrum of institutions, participants with multiple drafts and reviews. We had this launch on April 7th. And then within a month, exactly a month and 2 days from the launch of the principles on April 7th, then AHIN conducted this interactive webinar. So one of the ideas is to get together a broad spectrum of experts, and then to have a representation from the care recipients, caregivers, and then the Ministry of Health, who are also the focal points for digital health and the health data governance in the country, and then also have someone from the National Health Data Standards Body, and then also the perspective from a development partner or a donor. So this was one of the efforts that we have recently taken. And then we had wonderful inputs. So I would like to summarize a few things. I'm not trying to say who said what, but at the same time, some of the broad things, and everyone was appreciative of the principles. That is number one. And means everyone feels that, this is very much required. It's just that the gaps exist in terms of translating these principles into practice. That is where more support is required for the countries. And then, of course, as I think you would have seen that many institutions and organizations have already endorsed these principles, but then we need to move on to the endorsements from the countries, which is very important. That is where Regional Digital Health Network like AHIN can probably work together with Transform Health and make things happen. And let me share a couple of thoughts that came up from this workshop. So one of the things that was expressed was the technology is good, and but there needs to be awareness about it, for example, to translate these principles into action, because not only the technology, there should be awareness about confidentiality and means to have that in place that makes the technology work. And it's not just about promoting equity, but also being able to be accountable for that, and then never use data to marginalize or discriminate. And then there is a need for sharing data with civil society for transparency and accountability, because this was expressed from the perspective of care recipient and care facilitators of care. And then from the caregiver, like the need was like there is a really need for creating data sets, and that is sort of missing in this part of the world. That kind of efforts, I won't say missing, but that kind of efforts needs to be taken care. And then health data is of course a public good as long as there is transparency, accountability in data collection and access, and being responsibly used. And one of the suggestions was don't wait for eternity for quality data, because quality is a journey. It means perfection is a journey, and then like don't allow the health data to sort of remain in the servers forever, but then start putting the principles into practice. And then from hospital CMIO perspective, like there was like how like there has to be a process within the countries. Of course, this was also shared by the MOH official who had joined. Like they said like there needs to be a process within the countries to discuss with the internal stakeholders before any potential for adaptations, and then it leads to adoption. So it does take some time. So having to discuss internally within the stakeholders in the country, and then creating awareness, and then clearing their probably gaps in understanding is very essential. And then from the public researcher point of view, one of the inputs that we got is like these principles are very valuable and relevant for national operators. For example, those involved in universal health coverage, who are the custodians of huge amount of data. For example, millions of people data is sitting with them. So, awareness and working with such operators within the country is very essential. And then someone also said, like, at the same time, like health data needs to be handled with care. It's sort of fragile. So it takes time to gain the trust of the community. So we have to work towards it. And then another feedback that was provided was like how to actually, these principles are fine. And then in fact, they actually come under a bigger umbrella of human rights and universal health coverage. And how do we translate these principles into practice? Because there is a gap in terms of this how-to knowledge that needs to be built in terms of creating use cases, and then working together with this community of practice and digital health networks in the regions like Rekansa, Helena, and EHIN. And then from the donor perspective, one of the feedback that was received was like probably it's similar to digital principles of digital development and investment. I think we need to have this kind of coordination with the donors to have these principles being endorsed or appreciated in the countries where they actually invest in terms of building the digital health infrastructure. So this, I would say that, a bit of, means it was an 1.5 hour discussion, but then like I tried to share some of the main points, but this is just a journey that we have begun, and we have already have expressions of interest from at least 2 or 3 countries. The Ministry of Health officials have expressed that they would like to sort of work together with EHIN and Transform Health to have these workshops done within the country, to bring on board various other stakeholders, and then lead to sort of endorsements from the country level, because that takes a lot of time. So, but we have begun. That's what I would like to share right now. Thank you very much, and I'm open for any questions. Thank you.
Thank you so much, Jay, Francis, and Jocelyn, for sharing the regional perspectives and really talking through how they apply to the work that you're doing and how we can take these forward. I'm going to hand over to one of my co-chairs from the HDC working group to talk about some of the next steps and then wrap things up.
Thanks, Vidya. Hi, everyone. I'm Marie Donaldson, as Vidya mentioned, with the HDC's Digital and Data Working Group. Vidya, could you go to the next slide, please? In terms of the way forward, I appreciate that we're at the top of the hour, so I won't take up any more of our time, but just to say that we really feel that these principles serve as a great milestone for our global community. And now we're calling for a data governance framework, appreciating that that framework will not work in every context, but that it can provide sort of some of the key areas that can then be adapted and developed by governments to reflect their data, their health data context. Ooh, next slide, thank you. And we would love to work with everyone on this call to do that together. So please, you're very welcome to join our working group. We meet every second Thursday of the month. And in addition, if you take a look at we've put the link in the chat, but we can also send it again. Please have a look at the health data governance principles. And if you think that they reflect your organization's values, please endorse them. As was mentioned, we have 90 endorsements thus far, or maybe a bit more. And then we welcome you to join us at the World Health Assembly. There's an event, a side event next week. And I will put the link in the chat now so that you can please register and join us. And yes, just to continue to go about your work. I'm sure all of you are working in this area, thinking through how to do good health data governance. And we hope that these principles serve as a guidance, and we welcome your participation to continue to work with us as we develop the framework. Thank you so much, and I'll hand back to Vidya now.
Thank you for everyone who did manage to join and who has stuck around this far. As we mentioned, we are part of the Health Data Collaborative, and Mwenya, who is part of the Secretariat, is able to kind of close us out and take us forward.
Thank you so much, Vidya. And thank you, colleagues, for this fantastic presentation. We really encourage you all to take a look at these principles as mentioned. This is an opportunity for a lot of knowledge sharing and experience sharing amongst all of us here as partners. Again, this is your collaborative, as Craig mentioned earlier on, really is a platform that is made available for you all as partners to work together, of course, supporting many of the issues that are going on in the different countries that we are supporting. So on that note, I'll go ahead and close this meeting officially. The recording will be made available through the HDC YouTube channel, actually. And we look forward to seeing you again next month for our next HDC webinar. Thanks.